Hi folks, I'm Dr. Stephen Beyer. I'm a practicing chiropractor in Frankfurt, and I'm here to talk about how we treat peripheral neuropathy, how we do that very successfully, and what makes our office different in how we treat peripheral neuropathy is that we treat patients both metabolically and neurologically. Okay, so you're watching this DVD because you or someone you love is suffering from peripheral neuropathy, and they've given you this DVD, and what I'm here to tell you is that in our office we have good results, and part of the reason why we have good results, first and foremost, is because we don't leave any stone unturned in evaluating the condition. Okay, I get success treating peripheral neuropathy because I use specific metabolic and neurological testing and treatments. So what I want to talk about first are the metabolic treatments or metabolic testing that we do. How we treat the patient metabolically is all based on the scientific lab findings, the metabolic testing that we do. And so some of what we do metabolically, testing patients with peripheral neuropathy, is we do a thyroid panel. This is all via blood test. We do a thyroid panel. We do a complete metabolic panel, a lipid panel, and a CBC with differential, complete blood count. By doing all that, we can assess the thyroid gland, the adrenal glands, the liver, the kidney function, and we can see if a patient is anemic, among other things. Any one of those irregularities with any one of those areas can directly contribute to peripheral neuropathy. If a patient is anemic, and they may not know that, they're not getting oxygen to the tissues, and the condition just will never heal. If there's adrenal gland dysfunction, there's high cortisol levels and irregularities with the person's blood sugar as a result of adrenal gland dysfunction, and that inflames the nerves. A thyroid dysfunction, which may be there, can contribute to peripheral neuropathy also. And don't tell me, you know, I get this again and again, don't tell me I've had all this testing and it's normal, okay? Because I'm here to tell you that the lab ranges that are used are just way too wide. The ranges, the low and the high normals, okay, are just way too high. You need to use a more narrow range and check to see if you're within a functional range. You don't want to, just as an example, a person's glucose level or their blood sugar levels is considered normal as long as it's below 127. Well, I'm here to tell you, if you get above 100 with your glucose levels, and that's not right. You're out of that functional range, and from 100 to 126, you're what's called insulin resistant, or syndrome X, or metabolic syndrome, which is basically pre-diabetes. And so with all these other lab panels, thyroid hormones and things like that, a lot of times people are told they're normal and they're not. You need to check to see if you're within the functional ranges. And again, if there's a dysfunction in any one of these systems, the adrenals, the liver, the kidney, the thyroid, then it can directly contribute to a peripheral neuropathy problem. And that's part of the reason why people aren't getting results with the treatments that they do, because they have these metabolic disturbances, which are or irregularities, which aren't being addressed. Some of the other things that we test for are, we do sensitivity testing to determine if you have a sensitivity to gluten, which is in wheat, rye, oats, and barley. We check to see if you're sensitive to milk, eggs, yeast, and soy. If you're sensitive to any one of these food groups, it'll make this condition worse. It'll cause inflammatory reactions in the body. Some of the symptoms that would go along with the food sensitivity, although you don't have to have all of them, but some of the symptoms would be chronic pain or fatigue, frequent indigestion, bloating after eating, frequent loose bowel movements, constipation or mouth ulcers or sores. And the only way to find out if you're suffering from any one of these sensitivities is to do this metabolic test. The other thing that we check metabolically is to see how your adrenal glands are functioning. Your adrenal glands sit on top of your kidneys, and we do what's called an adrenal stress index, which measures the amount of cortisol in the saliva. You take a saliva sample over the course of 24 hours, and it measures those to see if they're within the normal range. And if they're out, if the cortisol levels are out of the normal range, and we can tell through this test, that'll directly contribute to inflammation problems within the nerves, which is what a peripheral neuropathy problem is. And your adrenal glands can get dysfunctioning from being in the past or currently being under stress, and who's not under stress? And Some people react to it differently. Some people can handle it better, but some people it causes their adrenal glands to start dysfunctioning. We can also do immune panels to see if there's any imbalances within the immune system and then whether or not there's an autoimmune problem. You could be having a situation where your immune system's attacking the nerves, and you know, until we get the immune system problem balanced out, which we can do, because with an autoimmune problem, the two halves of the immune system are just out of whack. They're not balanced, but one's way overactive and one's underactive. And if that exists and the immune system's attacking the nervous system, then nothing you do is gonna help until we balance that situation out. So we can run immune panels checking for the different levels, the different part 2 halves of the immune system to see if they're balanced. Basically the two halves are the Th1 and Th2. We measure the Th1 system by checking what's called interleukin 2 and TNF alpha, and the Th2 we can measure by checking interleukin 4 and interleukin 10. And so we need to check for that sometimes to see if the immune system's attacking. Some of the other things that we can check for are, if it's indicated, is we can check to see if there's an H. pylori infection in the stomach. We can do that by a breath test. Through another stool analysis, we can see if there's an intestinal permeability problem, or what's called a leaky gut syndrome, where food items are being absorbed into the system bigger than what they should because the barrier system isn't there in the gut, and it creates this inflammation problem within the body, and sometimes can be a part of the overall picture with peripheral neuropathy. That test is basically seeing if there's any toxins or microbes or undigested food or waste within the gut. We can measure your neurotransmitter levels, sometimes do hormone panels. We can see if there's an excessive amount of inflammation within the body with some of the markers on the blood tests that we do, such as by checking the C-reactive protein. And some of the things we can do treatment-wise to get the inflammation under control are glutathione. We use glutathione in a treatment of these different chronic conditions because glutathione is the motherlode of all antioxidants. It's a dramatically powerful antioxidant. You can't absorb glutathione orally, okay? You can't absorb it in a capsule form. You just can't. You can buy it out there, but it won't work. What we use is glutathione and superoxide dismutase together, which are two powerful antioxidants, in a cream which gets absorbed through the skin and directly into the blood system. And that can help dramatically decrease antioxidants such as this can dramatically help decrease inflammation within the body. So that's some of the things that we do testing-wise metabolically, and then whatever we find metabolically through the specific laboratory test, we do specific approaches or treatment protocols to address those irregularities. We don't just guess and do folklore nutrition. Well, you're having this symptom, try that. You're having that symptom, try that. We do specific laboratory testing or metabolic testing, and so the treatments are based upon those scientific lab tests. And then the other thing that makes our treatment approach unique with peripheral neuropathy is that we treat people neurologically. If you're looking at this on a DVD and not on my website, you can go to my website, which is Frankfortbbt, B as in boy, that's Frankfortbbt for brain-based therapy, because the neurologic treatments that we do are what's called brain-based therapy, which is a treatment protocol developed by chiropractic neurologists to balance out imbalances within the brain or areas within the brain that aren't firing as strongly as they should. And those imbalances or those areas of decreased frequency of firing can be corrected. You can get the electrical firing increased by doing specific treatments to stimulate and activate those areas. So we do, along with the brain-based therapy, or as part of the brain-based therapy, oxygen therapy. We have oxygen concentrators in our office which deliver about 98% pure oxygen, and that's helpful for these nerve conditions because the nerves are highly oxygen dependent. And so in conjunction with the oxygen therapy, we do specific treatments: auditory, visual, olfactory, caloric, which is warm water flush into the ear, stimulation treatments to activate those areas of the brain. We sometimes do laser therapy, non-surgical spinal decompression. If there's compression areas of the spine, it's more of a structural treatment. But interactive metronome is another thing that we do as part of the brain-based therapy. Interactive metronome, which you can get more information on their website, it's interactivemetronome.com, is a computer-based program that uses visual, auditory, and motor stimulation, which the three together are very powerful to stimulate and activate these under-firing areas within the brain that we determine through the thorough neurological exam that we do. We, of course, do the metabolic testing like I talked about earlier, but right from the get-go, with all new patients, we do a thorough neurological exam and are able to determine if there are these areas of decreased frequency of firing. So once we run all the necessary tests to determine, what your specific cause of your peripheral neuropathy is, we can get successful results by treating neurologically and metabolically. So I just ask for you to ask yourself just a few questions. One, how has your chronic condition affected your job, your relationships, your finances, your family, or other recreational activities that you do? Two, what does it cost you in time, money, happiness, sleep? People take sleep for granted. Three, where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? And four, what is it worth to you if we, through our unique approach, our metabolic and neurological approach, could help you improve your condition? So what I offer to people who've either visited my website or have gotten a DVD from a friend or a loved one, or have been to one of my workshops that I do on peripheral neuropathy or other chronic conditions that I treat, is I offer the first 2 visits in the office for $50, which is dramatically decreased. Normally it would be several $100s. And what I do in those first 2 visits are, in visit 1, I do a very thorough, complete neurological evaluation to see if there's any of those areas of decreased firing within the brain. I would review all lab tests that you had. Remember we talked about earlier how you can tell you're okay, and yet you're outside of those functional ranges. So if you bring those lab tests in, I'll look at them to see if you're outside of the functional ranges, and a lot of times people are, and they're told they're okay. So if you've had lab tests within the last year, go ahead and bring them in. We'll evaluate them. I'll have you fill out what's called a metabolic assessment form and a neurotransmitter assessment form to see if there's any disturbances there. Then on visit 2, I'll go over and review with you the findings from the neurological evaluation, what the metabolic assessment form and the neurotransmitter assessment form are telling me, and if there's imbalances there. I'll do a case review if I accept your case, and part of that case review would include what kind of treatment plan you would need to go through, and would review, before we go any further, any financial obligation that you would have to go through the treatment plan. The one thing I ask, though, is that you bring your spouse or your significant other with you. And I've done workshops in the past, and some people have said, I can't see you, Dr. Beyer, because I don't have a significant other. And the point is that I give a lot of information, and a lot of it's unique. And if you're going to need to go home and relay this to someone, then just bring that someone with you into the first and second visit, so they can get it right from the horse's mouth, so to speak, rather than have you try to relay it all. So I only offer this initial 2 visits for $50, again, to people who've been through a workshop, have visited the website, or have gotten a DVD from a friend or loved one. And quite honestly, I don't accept all cases. And if I don't accept your case, I'll refund the $50. And I'm serious about who I accept. They got to be a good candidate. And part of what makes them a good candidate is they're what I call a warrior patient. Okay, they're ready to get their condition improved. Not someone who's just kind of a little curious about maybe something new they'd never heard of, but someone who's looking to really do what they need to do to get better. I invest a lot of time and energy and emotion into my patients, and I do that because I feel I'm passionate about what I do, and I want to get people better, but I need them to be on board. So that's part of the conditions to being accepted as a patient, is that you're really looking to get better. And so if you'd like to schedule the first 2 visits for $50, you can just give our office a call. Our phone number is 815-469-8500. That's 815-469-8500. Talk to one of the gals. Tell them you've gotten a DVD and about the peripheral neuropathy. You want to schedule those first 2 visits for $50 with Dr. Beyer, and they'll set you up, and we'll take it from there. Thank you.